I have a better way of making bread. I'll just cook mine at 3,000 degrees for 30 seconds instead of for, how long is the bread? Instead of 450 for, an hour, okay? We'll just speed it up and cook it really fast. Well, as you know, that doesn't work, and neither do high frequency lasers, because what they're doing is they're going in and they're causing absorption of that energy. Absorption, that means heat transfer, high kinetic, damage to the cells. Whereas use a low wattage, it doesn't have to penetrate, because it hits the right area, is absorbed, and causes a cascading chemical effect that goes systemically throughout the body. And that isn't just theory talking. They've done some studies on that. Or absorption or energy transfer. Absorption, where the energy is absorbed by the body and it causes heat. Energy transfer is much like, it's exactly like what happens in your eyes. When if you're in a dark room, you turn on the light, there's the right amount of light, the light goes into your eyes, and based on what frequencies are picked up by the eyes, you see blue or orange or red or yellow. There's different receptor sites in the cone cells of your retina. Okay, and if it's a certain frequency, it'll be blue, another frequency, orange. If you dim the lights way down, you stop seeing color, don't you? You see more in kind of black and white. That's the visual purple, and it only works at low levels. If you put too much light, that visual purple gets inhibited. It doesn't work anymore. If you turn the light way up, the cone cells are inhibited. You can't see anything. If somebody shines a bright light in your eyes, you can't see anything, right? It becomes inhibited again. But the right amount of light is going to cause a stimulation and absorption, energy transfer, where that photon of energy from that light goes in. That energy is transferred to a chemical and causes a reaction or an action potential in the nerve that goes to the brain and makes you see something. Okay. If you put too much light or too little light, it doesn't work. The same thing happens throughout the body. If you get the right frequency at the right intensity, the body absorbs it and begins to utilize it. First of all, once again, we're only doing physiologic doses. If they have a pacemaker basically kicks on when the heart doesn't work at the right pace. It's slowed down, so it's going to kick it in. There's no danger to using cold laser with a pacemaker. Use it all the time. The only thing is, you can't do it right over the pacemaker, because the pacemaker's metal is going to bounce off, and it's not going to penetrate into it. It's very shallow. It doesn't penetrate into it. So you have to find an area where the pacemaker isn't and treat it there. I had a patient just. He's sleeping right over here. Speaking. Can you tell us what happened about 9 months ago?
Well, he came in and his heart was barely beating.
Right, he had what you call a right bundle branch block. That means the right heart and the left heart weren't getting the signal together, and they were totally disjointed. I've never, personally in this office, listened to one as bad as his was. My wife happened to be here. She's not normally does this part of the practice, but she came and said, "Honey, you need to go treat him now. Get him in a room or send him to the hospital, because he's going to die in the waiting room if you don't get there." Because he was all white, and he was just, like that. And I got him in there, and I started listening to his heart. I've got a cardiologist stethoscope. I could barely hear his heart, but I could hear that it was very disjointed and irregular, and there was no patterning to it, so that I knew that there was very little blood getting through that heart. It just wasn't working. So in times past, I obviously would have called 911 and had an ambulance come and take him to the hospital and get this guy to where he needed to be. But I've had a few of those kind of incidents before, and I knew that in the time it got in the hospital, I could maybe make a big difference. So we took him back here, put him on the thing. I think it's 25 minutes or so for heart health or muscle health. 25 minutes later, he's standing up full stature, red, nice red color to his face, not overly, but just, his color was back, and he was, had energy and was pretty normal. I think we had him come back the next day and did some circulation type, what we call retrograde health, where it helps the blood get from down low upward against gravity. And then Monday he went to the cardiologist because the reason we did this is we wanted to see if we could help him before he had some really invasive type procedures done to him. Because at 90 years old, when you start doing catheter, up through the vein and into the heart and start pushing up through here, what happens is you end up getting strokes and you end up dying sometimes. And that can happen to anybody at any age, but the older you are, the more likely those kind of side effects become. So we wanted to try to bypass that. So he went to the doctor, did his cardiologist for, I think it was a follow-up visit. They were doing more invasive procedures. And so that was Thursday, Friday. He went Monday. It was just the very following Monday. And they evidently listened to his heart and said, oh, I guess we don't need to do this, and said, we'll see you next year. Then he went home. To his doctor in Minnesota or South Minnesota. And for the life of me, I don't know why he did this, but the doctor gave him a stress test. I'm not sure why you give a 90-year-old man a stress test when he's doing well, but they gave him a stress test and said, he's as good as I can remember. I mean, his heart was doing great. Okay, so one very short treatment and totally changed, the outcome of this man's life, at least for a year. We'll see if we can get by a couple more years. You take them one at a time at 90, right? Yeah. Okay. But right now he's having a little bit of trouble getting some fluid out of his body, his kidneys and liver, and so we're treating that so he can, come back next year with silver. But those are the kind of things that we have happen. Now, I want to talk just a little bit about the effectiveness of labor. First of all, I don't believe that we do anything that isn't effective. I really don't. Because every single thing that we do before we do it, we test people. We test and ask the body whether or not this is something that it will absorb. And I think I could probably demonstrate that on most anybody. Let's have you come up, Jeannie. Jeannie, you've had some care. I don't know if you're the best person to do it. But let's see. Let's just see.
You're going to test my allergies and I forgot to remind you.
Okay. Well, I can tell right now. I don't know if you've had any Advil or whether you're on any anti-cholesterol medication or anything like that. But put your arm out. You just go right. Okay. Now I'm going to put this. I have this set for heart. Okay. Now this doesn't mean that Jeannie has a heart problem in the classical sense. But when I put it on her heart, she goes weak. Okay. And I don't know what that means other than her heart needs this frequency. So is it good to put this frequency on her heart? Yeah, I would say 100% assurity that it's telling me it's using this frequency, and in a few seconds it's going to be strong. Resist her heart. Now it's strong. So I know that frequency was good for her. Now how good, I don't know. Maybe just what happens is the heart is a real energy. You can have a seat. Did you notice the strength difference in that? There was pretty strong difference. So when you put a frequency on the body and ask the body a question, is this helping? It will say yes or no. It is going to help, and I do that. And so we're not going to do anything here that isn't beneficial to the body. So if there's a cost involved and you don't feel something, well, maybe you didn't feel it. But it doesn't mean something good was not done in your body. There's always going to be something beneficial to the body if it says it needs it. And maybe it only needs 10 seconds like her. So the heart's a very energetic organ, and it takes a lot of energy. And all it takes is to not have, for example, enough CoQ10, which is a really important energy molecule, antioxidant that the whole body uses. It's called ubiquinone, which means ubiquitous. It's throughout the body. But sometimes we just don't have enough of it. And this gives a little bit extra energy to the heart, so it gets it right back up to where it should be. And it kept my dad probably alive another year. He was really bad. He couldn't take a few steps without problem. So we had him, before I had the laser, I said, go get the surgery. He got the surgery, and he was pretty bad after that. And he got Parkinson's, took over because of the lack of motion, lack of activity, etc. But I started, when about 6 years into it, they said it would last about 5, it started getting real slushy again. This big gushing sound. So that's when I gave him my old laser, and I just had him use it regularly. And I didn't think about it. About a month later, I checked his murmur, and he didn't have a murmur. So I wish I would have had that the first time around, because I have treated quite a few murmurs since then. But it allowed him to fix his murmur so that he didn't have to have any more surgery. He wouldn't have done it anyway. But allowed him to live another year or so. He died about 2 years later at age 93. But the expense of what the laser therapy is just amazing. Probably the most dramatic thing about this is that, one, you can do this as a prophylactic type therapy. There are therapies called general health that you can just go through and do general therapy. You don't have to be sick to do it. It will go through and just systematically upregulate all the key organs and tissues in your body. And if you went through everything that we have to do of a general health nature, I think the most it would cost is about $1,000. Okay. A lot's happened in healthcare recently. What the new plans are is a minimum of $2,500. I mean, there's some phase-in stuff that some